Right. So now let's start. Today we are here to talk to you about what you call as the penile carcinoma part one. Now, this is again something which, as a general surgeon, you will come across. Like this is these patients you will come across day in and day out in your practice. So let's kind of talk about them a bit. Okay. Okay. So I think I have Bikesh and Manoj with me. So yeah, I would encourage you guys to kind of unmute yourself and interact with me because that will be beneficial for you guys. Okay, so I think Ali is also joining. So, yep, that's fine. So, Manoj, can I just hear from you? Hello, hi.
Yes, sir. Yes, sir.
Yeah. Bikesh, can you just unmute yourself and just say hi if possible?
Hi, sir.
Yes.
Hello, hi. And Ali, yep, so can you please unmute yourself? Say hello. Hello. Ali, can I just hear from you a bit? If at all it's okay with you? Okay, right. Okay, so Manoj, Ali, and Bikesh, I would really encourage that if you guys can unmute yourself in between and just interact whenever I ask questions, that will help you guys to kind of retain things for a longer period of time. Okay, otherwise, obviously, I'll continue my monologue, but yeah, like it will be beneficial if at all we interact a bit. Okay, now, whenever we think about the penile cancer, we should always think about what would have caused it. Okay. So, like, obviously, you guys would have come across this table quite a lot. Like, what are the predisposing factors for the penile cancer? So, broadly, what we can do is we can divide them into HPV related and non HPV related. Okay. So, what are the HPV related? So, what we have is carcinoma in situ, that is erythroplasia of Queralt, okay, and Bowen's disease, okay, erythroplasia of the Queralt and the Bowen's disease, okay. So can anyone of you tell me like what is the basic difference between erythroplasia of Queralt and the Bowen's disease? Yep, anybody? Can you guys tell me what is the basic difference between erythroplasia of the Queralt and the Bowen's disease? Unmute yourself if at all you can. So right. Okay. Yeah, you can type it, that's fine, but you can also unmute. Okay, so Vikesh has already told us that Bowen's disease is for the shaft. Okay, yes, that's fine. So the only difference is the location where the lesion is basically occurring. So that erythematous lesion, if at all it is involving the what do you call as a so erythroplasia of the Queralt is for the glands. Okay, this is for the glands, and Bowen's disease is for the shaft of the penis. If at all, this is the location. The basic difference is the location. The erythematous kind of a rash, it is occurring in the glands and at the shaft. Okay. Then what we have is a bovinoid populosis. Then we have a joint condyloma acuminata, which is called as a vasculovincian tumor. Then we have a warty kind of a growth. Then yeah, so warts and all those particular things. All these are the HPV related. What are non-HPV related? So what we have is lichen sclerosis, cutaneous penile horn, leukoplakia, pseudoepitheliomatous, keratosis, balanitis, mycaceous balanitis, all those particular things. Okay, so obviously, like you should remember at least 2, 3 of them, if at all they ask you that. HPV related, non-HPV related. Okay, now let us look at a couple of images. Okay, so what is this? This is how the erythematous rash looks like. Okay, what is this? This is what is occurring in the shaft of the penis. So this is what is a Bowen's disease. Okay, if at all this would have involved the glands, it would have been an erythroplasia of the Queralt. Okay, erythroplasia of the Queralt. Okay, right. Understood, guys? So yeah,
Yes.
this is what is the erythematous rash, which is basically present in the what we call as the shaft, and that is what is your Bowen's disease. Now, what is this? Anybody can unmute yourself and tell me what does it look like? Okay, so what is this cornified thing? Okay, so yes, it is a cutaneous horn. Okay, so what is this? This is what is a cutaneous horn. I would encourage if at all you can unmute yourself and talk. Okay, so yes, Prakash, absolutely great that you have answered it in the comment box. That's great, but you can unmute yourself occasionally. No issues with that. Okay, that will be better. Everybody will hear this. What do you think? What is this? Anybody would like to unmute? Yeah, Prakash. Okay.
Sclerosis, sir. Lichen sclerosis.
It is a lichen sclerosis. Okay. So what you're basically looking for is it's not lichen sclerosis per se. You would basically call it as okay, you can call it as a BXO kind of a thing. Okay. Lichen sclerosis Okay, you can call that, no issues. But this is what is a characteristic image of a lichen sclerosis, where it is a lot of whitish patches are there and everything. Okay, so yeah, this is what is a BXO changes, or what you call as the phimosis, which is caused by the early changes of the lichen sclerosis or the BXO changes. Okay, so yeah, all these are the predisposing factors. So this is what is a full-blown lichen sclerosis. Okay, so the whitish kind of plaques which are basically occurring. This is what is there. Now, just one thing, if I wish to ask you, if at all, let's say you find, okay, if you find this kind of a changes or this kind of a changes, let's consider both of them are like that is what is an early changes of lichen sclerosis. This is what is a full-blown lichen sclerosis. If at all you find this in any particular person, what would you suspect? Like what else the patient can suffer from?
Diabetes,
Diabetes, that's fine. Let's stick to the urology. In the urology, what else you can suffer from? Well, what else the patient can suffer from? Anybody?
retention, chronic
Huh?
retention, chronic retention of urine.
Chronic retention of urine. Okay. Anybody else? Manoj, Satyaki, Ali, anybody else? Okay. So what I'm talking about is stricture. Okay, stricture. If at all there is so lichen sclerosis and urethral stricture are very, very much associated with each other. Okay, so that is what you need to understand. The patients can have narrowing of the urethra, and then the patients can suffer from the stricture, which can lead to the chronic retention of urine. Okay, so yes, you were indirectly correct, but chronic retention of urine can happen because of a number of reasons. Okay, so that is something which you need to understand. Lichen sclerosis is very much associated with the urethral stricture. I hope you understand at least the basics of it. What is the urethral stricture? We have a urethra and there is a narrowing in the urethra. That is what is called as a urethral stricture. Okay, what is this? VART kind of growth, right? Okay, this is very good. Yeah, I think Vikesh was about to tell him, spoke. I'm sorry, asked a question. I did not wait for the answer. Okay, so what is this? This is what is a VART growth, which is basically occurring on the glands and the the coronal sulcus and everything. So this is what is it? Okay, right. Now let's talk about the like the penile cancer, which is predominantly what is it? It is a squamous cell carcinoma. So 10% of the malignant neoplasms in the men in some Asia, Africa, and whatever the South American countries, that's fine. 10% of all the malignancies of men. Penile cancer is a disease of older men with an abrupt increase in the incidence of the sixth decade of life. Why older men? Why older men? What do you think? Manoj is trying to say, but I think there's some network issue. Manoj, I think there's some network issue on your side. I'm not able to hear you. Sorry, I'm muting you. I'm not able to hear you. Sorry. Okay. Anybody else wish to try? Satyaki, Ali, Vikesh. Why older men? Why older men are specifically more associated with this?
Sir,
Is there an issue on my end, or like the network issues on my end or at your end, guys? Okay. Anyway, so why older men is because see, whatever the irritating factor is there, let's say BXO is there, or for example, smegma, the phimosis, that is again one of the risk factors for the development of a penile cancer. Obviously, it is going to take some time for the changes to happen, right? And that is the reason why this is a disease of an older man. Nothing very tricky about this, but yeah, the only thing is whatever the irritating factor is there, obviously that will take some time for the kind of cancers to kind of develop in the background of that. That's all, nothing else. Okay. Now, the incidence of carcinoma of the penis varies according to the circumcision practices, hygiene standards, phimosis, number of sexual partners, HPV kind of infection, and exposure to the tobacco product. Now, this is obviously something which is important because what you need to understand is that, uh, like Muslims, okay, or the Jews, what they do is they basically have a neonatal circumcision. In that particular scenario, the risk of the penile cancer reduces very, very drastically because the prepuce is not there. So, like phimosis and whatever the smegma, all those particular things will not be there. And over a period of time, the risk of the penile cancer is lower in them. Okay, so that is what you need to understand. Hygiene standards. So, what happens is that many times we encounter patients, and when you examine those particular patients, when you retract the kind of prepuce, you see that these guys have not cleaned their glands for like months together, and what you see is a very, very thick whitish substance which is deposited. What is that? That is what is the smegma that can lead to development of